So this month we celebrate National Hispanic Heritage Month from September 15th to October 15th. And then the agenda for today. So starting now, we'll be having the meeting overview and guiding principles. The Los Angeles General Medical Center will provide an update. We'll be getting a community health update. Have a presentation on school response to ICE actions. And then we're going to finally, last, we'll have legal support services for families.
Thank you so much, Elijah. How are we doing with the interpretation in the room? ¿Ya todos bien aquí en el salón? Muy bien. Excelente. Okay, I'm going to go over the guiding principles from our vision and mission document that created Health Innovation Community Partnership. Number one, all participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. All participants will state views and ask genuine questions. All participants will seek to avoid monologues or arguments, move to conversations where participants are curious and seek to understand various points of view. So you fail? We're still having a little trouble with our interpretation in the room, so I will be a little patient. Yeah. ¿Ya mejor? Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand and our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for this meeting. During meetings, only one person will speak at a time, and we will not engage in sidebar conversations. Participants will work to develop a comprehensive common set of information with which to solve problems and make decisions. And participants will jointly design next steps. So with that, I want to make sure that everyone is okay that is listening to interpretation in the room. Ya se escucha bien aquí? Excelente. Okay. All right. Well, with that, we will begin our meeting. And as always, we have our gracious leader of our LA General Medical Center, Jorge Orozco, who's here to share a few words. Jorge, good morning.
Good morning and buenos dias a todos. It really is my pleasure to be here. This is such an important meeting for LA General in that we get to share what's going on our medical center campus, but also hear from you, hear what concerns you have, what questions you have. And so that is of very much high value to us as we look towards you to help guide us in our efforts. Let's see. Who's in control of there? You're in control. Okay. So I'll start with bad news. We are really facing an unprecedented challenge to our budget. And it's primarily driven by the reductions, by the big bill that was passed by the federal government that targets Medi-Cal payments. And so we're going to be reimbursed less for what we do for our community. And at the same time, our costs continue to go up. Costs of medicines, costs of equipment, costs of supplies, cost of labor has significantly gone up, and our revenues are going down. Of our patients rely on Medicaid. And so the impact to our hospital as a safety net provider is significant. We project that in the year 25-26, that we had a $750 million shortfall. And then by year $280 million shortfall. And then by 28-29, we have a $750 million shortfall. That's significant. That is, something that is very, very difficult to address unless we get the reimbursement reestablished. So by the year 28-29, we project a $1.85 billion shortfall. And this is for our whole system. This is not just for LA General. Go ahead. Here at LA General, so what we're doing, we are facing a shortfall now. But the fortunate part is we have some funds in reserve. And those funds will carry us through the next 2 years. In the meantime, what we are doing is working aggressively to reduce our costs. Here at LA General, we have a 3% target reduction of our budget. Now, 3% may not sound like a lot to folks, but 3% equals close to $70 million for us. So we've implemented hiring freezes across the board. We are looking at how we're spending our money on non-critical purchases, how we use labs, radiology, pharmacy. We're deferring things that need to be fixed to maybe the future. We're also looking to increase our revenue. So we're looking to health plans to increase our negotiated rates with the health plans. We've been able to draw down Measure B funding. This is for trauma centers to support our efforts. And our system has launched a multi-year billing and collections improvement project. So we maximize the amount of revenue that we get from the federal government, from health plans, from insurance plans. But even with these efforts, the cuts, as you saw, are really too large by belt to be addressed by belt tightening alone. Next slide. So we're also looking at what we're doing. Our main efforts are to maintain the critical services that we provide. We've been fortunate in the last couple of decades to be able to expand from the core services that we're required to provide. So we're looking at efforts to reduce some of the services that we're currently providing. And here's some examples that we're just thinking about, just so that you know. Showers of Hope. This is a shower program that is for unhoused individuals that we run one time a week on Fridays across the street. We're not required to provide these services. Doesn't mean these services aren't important, aren't valued by our community, but we're not required, and we don't receive any reimbursement for that. So we're looking to reduce those. We have a breathmobile program that goes out to schools in our communities. This program primarily serves non-DHS, non-responsible patients. and it's a very costly program. We're not required to provide these services. For our patients that we're responsible for, these patients, these kids can come here to receive these services. They don't need to receive these services in the school. So we're looking potentially at reducing that program. Now, any of these ideas, if we get to the point where we're actually going to reduce those programs, we will make sure that we comply with public notice, public hearings. Some of these reductions will require Bielenson hearings. These are open public hearings about reductions of healthcare services. We also run a high school clinic in the community. This is one day a week or 1/2 day a week. Not required, very valued by the students and the families. But we're looking at reducing these non-critical, non-core services. Fertility services. These are services that are not required by any agency in the state and that we've been providing. We're looking critically at those. We're also, because we're a system, we're 4 hospitals, 21 clinics across LA County. We're also looking at, does it make sense that every hospital has the same services? So I'm a Kaiser member. If I need an orthopedic surgery, they'll send me to another Kaiser hospital. And so we're looking at those kinds of things. So an example is radiation oncology. LA General has radiation oncology services for our patients. Harbor is sending their patients out into the community and paying a contractor to do that. And so we're looking to consolidate all radiation oncology services here at LA General and eliminate the duplication of services in the community. It does mean individuals may have to travel a little bit more, but it does allow us to deliver these services in a more efficient way. Go ahead, Connie. So keeping our hospitals open is really the priority. Thank you. As we're facing these significant budget shortfalls, that is our primary goal. We need to keep our hospitals open, and we need to reduce the impact to our workforce of any reductions. So that's why we're fighting right now to tighten our belts, also look at consolidation of programs, eliminate any programs that are not essential, not required. Let's see. Our system is so important to the health of Los Angeles, and we're important not only because we serve patients who are uninsured, underinsured, but we also play an important role in the whole ecosystem of healthcare in Southern California. So the other thing that we're going to be facing is this bill has made it very hard for people to keep their Medicaid insurance plan. It's going to require people to work and to document that requirement. It's also going to require people to keep signing up every 6 months. And there's a lot of paperwork around keeping your Medicaid. So the anticipation is there's going to be a huge reduction in the Medicaid enrollment and an increase in uninsured patients. This organization is committed. Our mission is to provide world-class care to all in our community. And so we're fighting hard to make sure we maintain that. Okay. Before I go on to immigration, I just want to see if there's any questions around our budget. And yes.
Buenos días, mi nombre es Marta González. Trabajo en Clínica Romero.
My name is Marta González. I work in Romero Clinic.
Por 5 años hemos estado apoyando los
We've
programas de
been
shower home.
supporting the shower program for 5 years.
Es lamentable escuchar los recortes que va a haber porque cada
It's
viernes
so sad to hear there's a downfall
dice a las
and
7 de la
cuts
mañana hay una
because
gran línea
every
esperando.
Friday there's a long line outside waiting for the services.
Tenemos aproximadamente 2 meses.
We have approximately 2 months
Siempre ha sido de 40 a 50 personas.
that
que
we've
tienen,
received between 40 to 50 people.
pero por los últimos 2 meses hemos
For
incrementado
the
a
last
70
month,
personas.
this has increased to 70 people.
Y es triste escuchar eso porque
It's very sad to hear
personas es el único
this
medio que tienen para bañarse.
because it's the only
Pienso que va a ser
resource, the only way they can take a shower,
y muchas
and
gracias
it's a
por
great loss for the community. Thank you so much.
No, thank you for sharing that perspective. These things are painful. These are all of these programs are so valued by the individuals that are touched by them, and we don't take these reductions lightly. But really, our focus is how do we maintain our core services, our trauma services, our inpatient services, our outpatient services. That is our core mission. That's what we're trying to do. I am optimistic that this is just a challenge in our history that we will rebound from. And hopefully we will be able to restore any programs into the future that are impacted. Any other? Yes, Ari.
So with reapplication, the requirement every 6 months, but you already know who the folks are, and I guess you ongoingly recruit. So I'm wondering if there's some sort of an AI program or something that could help populate those forms and get people to just re-up on a regular basis with minimum effort.
I don't know of any, but I think it can be built. There's a lot of thought and efforts happening now on this challenge. DCFS is DPSS is the county organization that is responsible for Medi-Cal enrollments, and we've been in conversations with them in terms of how are we going to facilitate this re-enrollment and this bureaucratic nightmare that our patients are going to face so that they don't lose their coverage. All hospitals in LA are worried about this, and all hospitals are thinking about how to make it easier. If there's an AI program, absolutely. Yeah, we welcome that. Yeah.
Buenos días, mi nombre es María Ponce de León.
Good morning. My name is Maria Ponce de León.
Soy promotora de salud de Clínica Romero.
I work as a promoter in Clínica Romero or Romero Clinic.
Yeah, mi pregunta es,
My question is,
cuando se cierran estos programas, usted dijo
when
que había algo implementado para los
there was
estudiantes que puedan
something
venir aquí.
implemented for the students to come here, right? If they close these programs.
Otra vez con lo de los homeless, estas personas que
And
no,
going back to homeless people,
¿qué programa o qué piensan hacer con estas personas
what
que
programs are there
necesitan alimento
for
cada
homeless
viernes?
people every Friday, people that is looking for food
O bañarse durante
or
el tiempo.
that they're looking for showers, for example?
¿Y cuándo va a ser la fecha exacta para ir implementando otra forma
And
en cómo
when
ayudarlos?
will be the exact date where we establish another way to help them?
you. Thank you for your questions. If these services are reduced, we are hoping that the agencies that are responsible for these kinds of services will step up and fund these services. So we hope that they will continue, but having some other agency funded. As you know, LA County consolidated their homeless services department, and there is a lot of outside funding for this kind of activity that we currently do not receive, that may be able to support these services. So we will be in contact with those agencies to see if there's a way to be able to continue those services if we stop paying for it. Yeah. Okay. Want to move on to another depressing topic, which is immigration and immigration raids that are happening and really tormenting our community. This is has been a huge challenge for us here in the medical center as we really fight to keep this a safe place for our community to come seek care. As these immigration raids have happened, I know our doctors and our clinical teams have and continue to offer our patients televisits, telephone visits, video visits, if they are afraid to come in. We have also put up signage to inform the community of their rights. We also put signage of ensuring that ICE enforcement does not happen in our waiting rooms on our campus. Unfortunately, we have had the presence of ICE on our campus, and it's only been for them bringing in someone they have in custody who is hurt for medical care. We have experienced that in our emergency department. We have experienced that inside our hospital. And so our role is to provide amazing clinical care to our patients and not to get involved in advocacy work and not to get involved in any other types of activity other than support the care that the patient deserves and receives. We continue to need to send this message out to our community that we are fighting to keep this a safe place, because healthcare should not be impacted by the fear that is happening in our community. So any questions around immigration raids and LA General? Okay. Well, thank you so much. That's okay.
Thank you so much, Jorge, for your continued support of this community group and always being a champion. You know, you mentioned you're not advocating, but we see you advocate for this community, and we appreciate that. And all of the leadership here at LA General. I know I see Marco, our COO, in the audience. There's a lot of leadership support. You know, our head of urgent care, our chief of urgent care, is also here, Dr. Gonzalez. So, you know, it really is a difficult time for everyone. And the fact that we know each other, the fact that we're here together in this effort, really helps us understand that we're in it together and we're going to get through it together. So I know it wasn't easy news, but it's important that we stay connected on what's coming and support our community in making sure that if they need to apply for their renewals every 6 months, that we support them in doing that. So at the Wellness Center, we're working on that as well, making sure that we have a good workflow to help people. And there are programs, you know, such as our Maternal Child Health Access Program that is at the Wellness Center that are doing this every day. So we appreciate everyone and your efforts. Let's go to the next slide. Let's see if this works. All right. Okay, so next we're going to have our campus update, and we have Parisa Dadmehr, who is here from the LA County Department of Public Works to give us an update on our progress of the RCV, Restorative Care Village, phases 4 and 5. Lots of effort in the construction front, and we're just really excited to see these buildings coming up so very quickly, and the services that they will provide for a diversity of our community to be here. So, Parisa, if I can have you come up and share your update with us, we appreciate it.
Good morning, everyone. Happy to be here today. Hopefully, presenting some good news on the new constructions that are going on this campus. If I can have the next slide, please. Yeah. Thank you. So we have what you see on the screen right now is basically Restorative Care Village Phase 4. It consists of a 2-story building. First floor will be the Mental Health Urgent Care Center, and the second floor is a residential withdrawal management program. We have this project about 90% complete. We're hoping to deliver this project towards the end of this year, fall of 2025. We are providing some update. We are working on some landscaping that's happening right now. So this is in the corner of Mission and Zonal. So if you happen to pass by it, you'll see a lot of movement going on. We have, we're working currently on some interior work, flooring, cabinetry, casework, things like that. We are hoping to schedule a grand opening for this project towards the end of this year. And that's something that we're working with First District on. Next slide, please. That's fine. These are just some photos of the interior and exterior, just to give you an idea, again, for those who haven't had a chance to see it, just to give you an idea of where we are with the construction. Next. Next development we have going on is going to follow right after that. This one is the Restorative Care Village Phase 5, and project is about 30% complete on this one. We have, if you happen to pass by it again, we have a full steel structure that's been up. We're working on pouring some concrete floors. This is a 4-story building. It's going to provide 96 beds of subacute facility for the community to use. And this project is on schedule for completion of end of 2026. As part of the grand opening ceremony for RCV 4, we're hoping to have a belated groundbreaking ceremony for this project as well. Again, this is something that we're working with the board office, and we'll have a date in the near future to announce to everyone. Again, these are just some photos for you to see, some mostly metal framing and just some site work going on. And that's all I got. Thank you. Any questions?
Yeah, before you leave us, are there any questions? All right.
Thank you.
It looks really exciting out there, Parisa. Thank you so much. We appreciate you. Next, we're going to have Dr. Gonzalez introduce our next presenters.
Good morning, everybody. So I never want to miss an opportunity to highlight the people that take care of you, the people that I get to work with every day to take care of our communities. So today I'm really excited to bring one of those faces to you. This is a new face for us here at HICP. So we have today Dr. Ankit Chopra, who will be talking to us about something really, really important, back to school physicals. And this is like the sports physicals, and lots of things could be caught during that time. So I'll invite Dr. Chopra to come on up. Thank you.
Thank you. All right. Good morning, everyone. My name is Dr. Chopra. I'm one of the pediatric chief residents here at Los Angeles General Medical Center. Kind of like what Dr. Gonzalez said, I'll be talking about sports physicals today. Good timing since a lot of kids are just now getting back into school. And as you'll see, a lot of kids also play sports. And so an important topic today. So kind of a little agenda for my talk. I'll go into a little bit of background about sports physicals. Then we'll actually talk about the benefits of sports participation and what kids can get out of it. And then we'll talk about the pre-participation evaluation, which is also known as the sports physical. Then we'll have a conclusion and then some time for questions at the end. All right, so some background. So in 2023, so just a couple years ago, they looked at all the kids in the United States aged 6 to 17 years old and saw that about 55.4% of those children played a sport actually within the last 12 months. This number used to be a little bit larger, greater than 60% prior to COVID. Went a little, kind of got closer to 50% during COVID, but in the recent years, the number's going back up with an estimate that it'll be back to that 60% by like 2030. And then this number represents roughly about 27 million kids who play sports. So some benefits of sports participation. There's like 3 main categories. There's the physical benefits, which we're all probably most aware of, but there's also mental and emotional and social benefits that kids can get out of sports. So kind of going into the categories, we can talk about physical benefits first. They can have improved like heart and lung function, improved bone health, stronger bones. They can have decreased total body fat, increased muscular fitness, and then increased energy levels, which I know for some parents might be like, my kid's already like super active and running around. Why would I want them to be more energetic? Well, it could be like increased energy levels when they wake up in the morning. So like it might be easier to get them ready for school. Next, we can mental and emotional benefits. Kids who play sports actually are shown to have like decreased rates of stress, anxiety, feeling sad. They might have higher confidence levels in themselves, increased mental performance. So that can translate into doing better at school, improved grades. They might actually have increased life satisfaction and just be happier in general. Some of the social benefits that we can get from sports is improved teamwork. They might be more empathetic or more understanding of what other people are going through. They've shown to have less risky behaviors compared to children who don't participate in a sport. And then improved time management and work ethic and like personal responsibility or other characteristics that might translate into like a work or a job later on in life. All right, so the pre-participation evaluation. This is like the majority of the talk. This is also known as like the sports physical. It has 3 main components. The first part is getting the child's medical history. After that, we get the family's medical history, and then finally do a physical examination on the child. So to start, so for the child's medical history, there's a lot of questions that we ask. These are just some of the highlights. And most of the questions are directed to try to find anything potentially that the child could have underlying that might cause an issue if they participate in a sport. So some of the questions are, do they have any history of like breathing or heart issues? You see the word heart is highlighted. I'll kind of go into that later on, but that's one of the key components of the sports physical. Do they have high blood sugar levels that need treating? Have they broken bones previously, or have they suffered a sports-related injury in the past? Any history of like head injuries or concussions, which might make them at a higher risk for like further head injuries? And then any history of like allergies or allergic reactions. This one kind of comes into if like the sport is played outside, like football or tennis, where there could be bees or other environmental allergens that could potentially affect the child. And then, like I said, these questions are to kind of decrease any potential harm the child might have if they participated in a sport. Next, we have the family medical history. So there's 3 main components or 3 main questions that we want to know about family medical history. First one is any like family history of high blood sugar that needs treating. So things like diabetes. Any history of allergies, skin rashes, or breathing difficulties. This could just mean that the child might be at higher risk to have an allergic reaction potentially if their parent or another family member has had like severe allergic reactions in the past. And then lastly, again highlighted, is any history of family heart disease, especially in those less than 50 years old. And we'll kind of dive into heart health a little bit later. And then the last part of like the sports physical is the physical exam part. So here, the kind of one of the first things you like that is done when you walk into a clinic, we get vital signs. Vital signs look at a lot of different things, but something that we're really focused on during the sports physical is the blood pressure. Certain like high blood pressure numbers might actually prevent you from playing a sport. And so that's something we need to check. After that is essentially a full head to toe assessment, kind of looking at all aspects of the child and making sure we're not missing anything. But some things that we highlight are vision screen. Got to make sure you can like see the ball if you're going to go play. We'll check strength and like sports specific movements to ensure that if the sport that they're going to participate in, they'll be able to kind of participate fully without any like restrictions. And then lastly, again, heart exam. And then I have this highlighted, but we're looking for like abnormal heart sounds and potentially doing even like a more of a workup or like studies to see. So now heart-related history seems to be really important. It's kind of talked about in all three parts of the sports physical. And that's because one of the biggest things we're trying to like look out for is any potential for sudden death. That's like the scariest thing, is any sudden death related to an underlying heart like issue. And that's why we really focus on heart health in our kids when we do a sports physical. And that's why each component of the sports physical really emphasizes heart health in these children. It's not exactly known how many athletes have an underlying heart disease. And although it is rare, a sudden death is just very devastating, especially for like future generations, which are our kids. So that's why it's something, even if we only catch 5% of kids, that's better than 0%. And then the sports physical won't catch every kid with an underlying like heart issue. Sometimes like the family could be totally healthy. They themselves were totally healthy, but then unfortunately something happens, but it can minimize like that number. So instead of like 10 kids who might like get missed, maybe we only miss like 3. And so conclusion, so most school-age children participate in a sport every year. The number was about 55% a couple years ago. Sports are beneficial in multiple ways, like we talked about. There's social, emotional benefits, physical benefits. And then the sports physical has the 3 parts, which was the child's medical history, family medical history, and the physical exam. And then just to kind of re-emphasize, heart history and exam is really important. It's essentially the biggest part of the sports physical. These are some references. And then any questions?
Thank you so much, Dr. Chopra. This is really exciting to be able to have this time with kids too. So are there any questions?
Buenos días. Mi pregunta es, ¿por qué no ponen
Good morning. My question
en las-
is,
en las escuelas,
why is it the schools,
¿cómo se llama? Una clase de primeros
they don't
auxilios,
have like a first aid class?
aunque sea una vez al mes?
Maybe once a month.
Is the question, why do schools not have like first aid classes for their students? Oh, okay. I know they like all schools have like health related classes, and then some schools offer like BLS, but you're right, not every school offers that. And that is something that maybe us pediatricians can advocate for, like with the schools and like the schooling district boards, to see if we can potentially get kids trained on BLS and some of those life-saving measures.
One thing is we always have a yearly Heart Saver class outside, so don't miss that. The kids can come to that too.
Mi pregunta, doctor, es para
Doctor, my question is,
sé la diferencia en que es el
I
examen
know
físico
the
del
difference
niño
between the physical exam for the child
y el examen de
and the
deporte.
physical exam for sports.
pero como promotora
But
de salud,
as a health promotora or
muchos
promoter,
padres a veces no saben
many parents
cada
sometimes don't know
cuándo le tienen que hacer el examen de
how
deportes al
often
niño.
they have to do the sports exam or physical exam for the
Y,
children.
y a veces vienen
And
a nosotros
sometimes they come to us
a decirnos cuando el
to
niño ya
tell us
necesita el
when the
examen.
child already needs
Dice,
the exam, right?
mañana tengo que presentar
Oh,
el papel
tomorrow I
con mi
have to
maestro
present this paper
de deportes.
in
Entonces,
for sports.
nosotros cómo podemos educar a los padres para que sepan que
How can
cada
we
año se
educate
tiene
the
que hacer el
parents
examen también, que es diferente al examen
that
físico.
they can know that this is different from the physical exam?
Yeah, great question. So like your yearly physical exam for a child is a little bit more comprehensive and covers more stuff than the sports physical exam. The sports physical exam is a little bit more focused. We're kind of really teasing out things that could like harm them if they played a sport potentially. Whereas like your yearly physical includes things they ask more questions, ask more like details about your history from the past year, but also includes things as like blood work, maybe some imaging, and then like immunizations or vaccinations for the child. And so those are like the key differences between the two. Something that we try to do is, well, since you need both only once a year, something we try to do is work with the families to have the child come in only for one physical visit and then try to do both at the same time and try to fill out their sports physical form. So we're kind of not having parents and families keep coming back for like similar things. It is a little hard because sometimes a kid might not know if they're going to play a sport until they start school or see some of their friends play. And then they decide, oh, I do want to play. And so sometimes then they do have to come back to get that physical done. But if they were seen earlier that year and they got some like labs or like other things done during the physical, we can use that information to kind of make the sports physical part a little bit quicker for them.
That was a really great question. Any other questions? I have one more. All right, this will be our last question.
Buenos días, mi nombre es Alejandro Castro. Y acerca
Good morning,
de
my
los
name is
deportes en
Alejandro
las
Castro.
escuelas, ¿hay supervisión
Regarding
para los niños que
sports school,
sufren de
is there
deshidratación?
supervision if students are dehydrated?
My name is Alejandro Castro, and my question to you, if I was just wondering if there's any hydration program for the students that play the sports. Hydration program.
Hydration protocol. There is a hydration protocol. Per like our pediatric guidelines, they suggest like student athletes or child athletes drink about 1 to 2 liters of water as they train and kind of prep for their sport. And then as they play their sport to kind of maintain that hydration, some of the like biggest things that happen when children play sports is they might get dehydrated just from not having adequate water or electrolyte or fluid intake prior to like their events. And then also while they're competing, or if it's like hot out, since we're in Southern California, they might not drink enough water as they're playing to kind of maintain their hydration. And so the guidelines say 1 to 2 liters for like the student athletes is like a good way to ensure adequate, like that their bodies are hydrated.
Thank you, Dr. Chopra. Such an important topic and such a great question, particularly with the heat wave that we've been having. Thank you. Thank you so much.
Thank you so much. Lots of great information. And the next one. All right. We are now moving into our next set of presentations. This is on school responses to ICE actions. So we are pleased to have our Region East Superintendent, Dr. Lourdes Ramirez-Ortiz. And we also have Anne-Marie Gauto, Student Mental Health Administrative Coordinator, and Gilbert Martinez, Administrator of Operations for LAUSD. Finally, we'll have Dr. Melanie Sabado-Liwag from Cal State LA. So is Dr. Lourdes Ramirez-Ortiz here?
I am here. Hi,
Okay.
everyone. Good morning. Buenos dias. It's such a pleasure to be here with all of you and to hear the wonderful services that you provide for our schools. It was great to hear from our pediatrician to share how you're preparing our students to be healthy as they return to school, as they engage in sports. This is such a great partnership, and we're all serving the same community. So again, my name is Lourdes Ramirez-Ortiz. I'm the Region East Superintendent within LA Unified. I serve 255 schools that range from the communities of City Terrace, East Los Angeles, El Sereno, Boyle Heights, Southgate, Bell, Cudahy, Maywood, Huntington Park. I think that was most of them. So we serve approximately 107,000 students, and we're here to support and to help as best we can. We heard right at the very beginning, there are some concerns. There are definitely new challenges that we're facing. Also with a lot of optimism, we know that we can band together, support each other, and see our communities through. One of the biggest questions we've received from our community before school even opened is how will we support our families and our students with feeling safe and knowing that while they are in our schools, they are safe, they are sanctuaries. You saw our superintendent come to the news and social media sharing the process that we were going through and how we were going to provide those safe havens for our families and communities. I was very grateful that the request was, how do we keep our families and our students physically safe, but then also those opportunities for us to understand the mental health impacts that all of this is having. And so for that reason, it's my pleasure to introduce to you the two members that you heard named before. We have Gilberto Martinez, who is our Administrator of Operations, who will share with you our LA Unified We Are One campaign. And then we also have Anne-Marie Gauto, who will share with you the supports that we provide our students and our families with around mental health services. So with that, I will, again, my pleasure to introduce you first to Gilberto Martinez, our Administrator of Operations here at Region East.
So just a reminder for the speakers, if you tell us next slide, we can move the slides along for you.
Okay, thank you.
Perfect. Thank you, Dr. Ortiz. I appreciate it. And, first and foremost, thank you for inviting us. It's pertinent information for our community, especially around what's going on and the effects that it has. I also want to thank Dr. Chopra talking about athletics and athletic clearances and things like that, we work with our doctors and physicians to make sure our students are safe. So we are one. So I want you to know that the district is committed to ensuring the safety and well-being of our students. We have two major tasks. Right. One is providing a safe space for our kids so that when parents drop off their children at the school site, that they know that their child is safe. And then two, a robust instructional program to ensure that the students are learning and graduating in a timely manner and going on to be successful individuals. Okay, if I can go on to the next slide.
Is it the background slide? It's up.
Yes. Next slide, please. Okay, so November 19, 2024. Oh, the one before that. No, before.
You want the one before this?
Yes, please. Sorry about that. All right. So November 19, 2024, LAUSD, our board of our LAUSD school board, passed a board resolution that identified LAUSD as a sanctuary district and a safe zone for families. Okay, specifically around immigration enforcement. And we were to create protocols that would have a response for immigration personnel requests and information about students and staff. And then we were going to communicate those plans and resources and provide students and ensure that students feel safe and can thrive academically without fear on our campus. Okay, next. Apart from that, California law also, Ed Code and California public law also affects our schools. So one, we are a non-discrimination, school district in the state of California. All of California requires us to be non-discrimination. So all students, including those who are undocumented, have a right to free and public education on our campus. They have access to all of our school activities before school, during school, and after school, and then receive quality education without fear of discrimination. And that includes everyone, right, on our campuses. Secondly, we're committed to ensuring a safe school environment, and they're prohibited from voluntarily granting access to campus by immigration enforcement officers. And so outside of a judicial warrant, right? So if there's a judicial warrant, then we have to adhere to the warrant. However, if it's just a document that's provided by immigration that does not have judicial fortitude, then we will have to adhere to what the judicial warrant dictates. And so California is ensuring the safety and well-being, and then confidentiality with students. So schools must protect the privacy of students. So there's I want you to know that LAUSD, we do not collect information regarding immigration status. And so if we are asked for that, then we don't have that information, so we cannot provide that information. So we want to make sure to remind our families that we only collect information that's pertinent to the district. Okay, next. So LAUSD, so one of the things that we realized is that I think one of the things that we as a district, we do so much for our students. And I want to just reiterate that. Like, we have so many services, so many programs outside of immigration support services, but like we have a plethora of services for the school district. And I strongly recommend that parents and families reach out to the schools and ask for what services are being provided at the school site, because we have a robust opportunity for our families. So one of them is our school enrollment placement and assessment centers, or also known as SEPA centers. So when students come from other areas of California or out of the country, we have these SEPA centers that are set up and can help families transition into the district. So we provide them assistance with enrollment, we provide them immunization, medical and mental health referrals, legal services if needed, and health insurance enrollment. So one of the things that we do is we really acclimate them to California, the city of Los Angeles, and our schools. We also have extended support sites that connect students and families to LAUSD programs, such as after-school programs, before-school programs. And really, we target these high volume areas, these dense areas like MacArthur Park area, right, that are densely populated so that we can provide support. Okay, next. In response to our board resolution and what's going on in the community, we adopted the We Are One campaign, and we created a We Are One webpage. I want to direct everybody to this webpage, as it contains a lot of the information that is current, information that we're sharing with our families, access, all kinds of different resources that we're providing as the times continue to change, right? We noticed that things continue to morph throughout the days, and changes and what's going on with immigration statuses and so on and so forth. So I want to just redirect everyone to the We Are One campaign, the We Are One webpage, as this is the most current and pertinent information. Okay, next slide. So on this page, back one. Yeah, there we go. So on this page, there are several tabs. So all resources, immigration resources, health and wellness, food assistance, state and district policies. So this website really provides a robust information for our families, and it has a lot of handouts and guides. If you could go on to the next one. Okay, and it has a lot of handouts, guides, videos, protocols of what the district does, referrals for our families. If you can go on to the next one. And so we created like these one pagers. And so if you click on those two links, I'm sure that the PowerPoint can be shared, but if you click on these two links, we have a family prepared care package. We have our resource guide. And these are like it's step by step information for our families to be able to be informed, to be able to be guided, and so on and so forth. So if we can go back, yeah. So again, the family preparedness care package, one of the most important things is really creating a safety plan for our families. For example, or working with our families to create a safety plan at home, and to ensure that families have a designee. God forbid, should someone be arrested or detained by ICE and they're the parents, then we have affidavits that parents can sign that allow for another individual to take custody of their child while at the school. For example, they could come and pick them up. Secondly, most important is really how are we ensuring that families are filling out their emergency cards, right? And make sure that those are updated. So then that way, if there is an emergency of any sort, that we have the most current information to access and provide family support and information. Okay, next. So as part of the family preparedness resource, one of the family preparedness resources is we have webinars. I'll talk about that in a little bit. And then our guide. So our guide is robust. And then what we've done is we've gathered a lot of information from other community entities and community partners to provide one site for our families to be able to access. So again, I keep on referring us to the We Are One webpage, and the We Are One webpage has that information. Okay, next. Right. I'm going to pass it over to Anne-Marie Gauto.
Before
good
we
morning.
move on, there is a question.
Oh,
How are these services promoted to families, and how can we ensure families are aware of the plethora of services you just mentioned?
so one is I'm going to refer us to our district website, specifically the We Are One homepage, and that provides the information for our families. Two, we are constantly promoting it on our social media pages, both at the district, the region, and the school level. Thirdly, principals are sharing information on a regular basis during coffee with the principal, during their sending out information on their newsletters, and so on. We're also providing what we call BBCs, which are Blackboard Connect, which is our family phone calls. And so in those family phone calls, if we have, let's say, for example, we have law enforcement activity in the area, then we utilize that to inform our parents of this information. Okay. All right, Anne-Marie.
Okay, thank you. So good morning, everybody. I just want to talk a little bit about the impact of trauma on our immigrant families, and not just our immigrant families, but families maybe with mixed status in their home, or just, students who are feeling the anxiety for friends that might feel, have that worry in their home. So some of the things that we are experiencing, our students are experiencing, is chronic fear and anxiety. There is that real threat of separation from a caregiver or, a loved one. And it truly does reshape their development and their mental health. As you can imagine, it's a very challenging situation for a lot of our youth and our parents and caregivers. They're feeling sort of the lack of stability that comes with maybe a loss of income or a lack of healthcare and other resources. We know that intergenerational trauma exists. Everybody's maybe immigration story is different. Some come with very traumatic experiences as they have immigrated to our country. Sometimes that can be transmitted across generations, and it can be shaped by conditions such as poverty or discrimination, or just fear of enforcement or the level of enforcement that has been happening currently. And what we know is that when children's worlds feel very uncertain and parents can't really guarantee the safety, it does create anxiety. It does create, worry, and it can be harmful to their emotional and brain development. And we can go to the next slide, please. So how we are supporting our students is we use a framework called psychological first aid. It's something that we use anytime we are responding to a crisis situation. And I'll talk a little bit more about that in the next slide. But really, we're trying to acknowledge and validate the feelings. As Dr. Ortiz said, our superintendent, we have a leader who is acknowledging and validating that this is a very scary time for our families and our communities. I know there are so many supportive staff on site that are holding the space for these students, providing continual check-ins, and it doesn't necessarily need to be a mental health check-in, just a quick check-in in the morning as a student-teacher relationship, a principal, anybody on campus, a trusted adult who's checking in with students, helping them identify their feelings and then also normalizing their feelings. It's really important that we reiterate to our students that the feelings that they're having are normal feelings, feelings that are normal for an abnormal situation that we're experiencing. Next slide, please. So psychological first aid is a great framework that we use, and it's It's not something that you have to be a mental health provider to be able to provide. Anybody on campus, most of our teachers and staff on campus are providing psychological first aid, and they may not even know that that's what they are doing. But really, it's a supportive approach to help individuals manage stress and emotions in challenging times. There's 5 components. It's listen, protect, connect, model, and teach. Our educators play a critical role in fostering the safety and easing the divisiveness that may, affect our schools and communities. One of the when we're looking at the 5 components, we're listening to our students, we're having an open heart, an open mind to hearing what they're feeling. We protect our students by continually keeping on maintaining our structures and our routines, because our students really thrive on having that structure, that routine, that safe person at school to go to. It's like most adults, we have our own routines and structures, and that provides a lot of comfort to us. But for students as well, it's very important. We're connecting with our students, so we're checking in, or we're connecting them to the individuals that may be able to provide that additional support, whether it's a social worker, a therapist, a counselor. We are making sure that we are connecting our students to the people on campus that can support them. We're modeling for them just sort of our own coping strategies and our own ways of dealing with stressful events. We're also modeling our own healthy sort of coping strategies. And we're teaching them, right? We're teaching them that this is a really difficult and challenging time, but there are people that are on campus that are there to support. We might have different reactions to what's happening, but there are trusted adults. We're teaching them that there are trusted adults in their community that are there to support them. We know that events in the community can trigger concern, fear, anger. And so we're really committed to supporting our students where they're at and how they come into our schools. It's important that we have supportive adult relationships at home and at school. So we're helping to build that resilience for our students in the midst of a really challenging time. And utilizing psychological first aid with students really can help them feel heard and protected. Next slide, please. And I think that's back to you, Gilberto, the community resources. Or do you want me to do the part?
We have another question.
Oh, sure.
Go ahead.
How is all staff being trained, especially at the bigger schools? Schools that have sports programs and ICE can come later when the administration isn't around.
That's a very good question. So a couple things. So one, school size doesn't really matter. Our protocols are the same across the board. So whether they're a small primary center or a EEC, which is an early education center, or a large comprehensive high school, the protocols are the same. So we issued what's called information. It's a IOC, which is an inter-office communication that allows guidance or provides guidance for all administrators on site. And so within that, it's the specific protocols of what happens if there's a law enforcement activity, right? Because we, as schools, we're affected not only by immigration, but also law enforcement. So I'm just going to refer to kind of general law enforcement activity. So there are protocols in place for specific law enforcement activity that goes on around our communities. So we ensure that we provide families with information. We give them a call right through our BBC program so that families receive information about law enforcement activity in our neighborhoods. If I should come on campus, then there are specific protocols that principals are to follow or administrators are to follow. Everyone in the office has been trained on these protocols. And so there's notification processes, there's information processes, and then we work with our own legal department to assess the warrant and then address the warrant, if there is an actual warrant, to address it appropriately within our law, within our legal department. Secondly, whenever there is law enforcement activity that affects our school sites, then we have a lockdown protocol that we follow. Trainings, as far as trainings are concerned. So one, the principal has been trained. We trained everybody before, or the administrators, because it was principals and assistant principals. We trained everyone before the school year started. On our first day back with staff only, what we call pupil-free days, we trained our entire staff using our protocols, providing them the We Are One information. And then the school sites are having workshops for parents during coffee with the principal and sharing our stance and what we're doing for immigration. Lastly, any athletic event has an administrator or designee on site. And so all of those administrators or designees, in this case, sometimes it's the athletic director that's on site, and they have specific protocols in place for lockdowns, right? So again, I'm going to refer to a lockdown for lockdowns because we know that incidences may happen in and around the community that affect our athletic programs. And so with that, there's protocols in place for any law enforcement activity.
So another question, and thank you, Brenda, for your questions. Are all staff credentialed or support staff? Do they all know what to do? What kind of training gets provided? And do students know what to do in different scenarios?
So all staff is everyone that works at the site. So at the beginning of the year, we trained all staff, credentialed, classified staff. And then we also are working on our volunteers and ensuring that our volunteers are aware. With that, specifically as ICE on campus, right, they have to go through the main office. They're not going to hop over a fence, right? So ICE will go through the main office. And if they do go through the main office and there's protocols in place that our main office staff or our office staff has been trained in and that our administrators have been trained in to address this, okay? So as far as students are concerned, really their students are following, again, law enforcement activity, the lockdown process, if that is indeed what we need to do. So if there is police activity in our community, whether it's ICE related or law enforcement related, LAPD, sheriffs, we work with multiple municipalities. So if there is that, then we follow the lockdown policies and procedures of the district. And the students are trained on a regular basis on lockdown. We do monthly drills on lockdowns, emergency procedures, and so on. All right, community resources. So we have, again, as a district, we are an educational entity, but we've partnered up with several community partners to provide resources for our families. So some of them that we've looked at are immigration services with CalNew. We've also worked with specific entities or legal entities like Chirla or Carecen, and we've referred a lot of our families out to provide those support. We also have internal supports that partner with external support. So for example, Anne-Marie talked about mental health and providing our students mental health during these difficult times in our families. We also have our suicide hotline, which is nationwide, which is the 988. And so that is available to students. We are checking in with students on a regular basis. If there is an incident of law enforcement activity within our school sites, we do offer mental health. Most of our schools have what's called the psychiatric social worker on site. And then not only is there a psychiatric social worker on site, but we also have counselors, PSAs, which are people services and attendance counselors, and a robust mental health support if needed at our site. If there's anything that's a big impact on the school site, then Anne-Marie, we work collaboratively with Anne-Marie to send out a team. We have our regional crisis team, and then we have our school crisis team that deals with major crises that are happening on campus. Okay, next. All right. We also have our Know Your Rights webinars schedule. So on a regular basis, we have meetings where we have these opportunities, these Know Your Right webinars for our families. If you could go on to the next slide. So I want to make one correction on this next slide. It says Thursdays, but it's actually Fridays. So we just got an update. So Fridays moving forward, the first and third Friday from 9 to 10 a.m. we have this Know Your Right webinar, and then the second and fourth Friday from 5 to 8:30 or 5 to 6:30, we also have the Know Your Rights workshop. So this is provided by legal services and partners within the district for our families, and it's a Q&A. Again, I'm going to refer you back to our We Are One webpage as they provide the most current information.
Thank you. And if you update the PowerPoint, we can send it out when we send out the packet to everyone who's here.
Perfect.
We have a question in the audience.
Yes.
Hi there.
Hi, Ari.
My name is Ari Gutierrez Arambula, and I want to give a shout out to Anne-Marie Gauto, who's a friend that I didn't know would be here. But I also want to, definitely shout out to LAUSD and this team for their leadership in this important topic and for jumping on it. The school district itself, the board, for jumping on it and coming up with these policies. And thank you so much for your leadership, which, as we know, is not just for LA and all of its school districts, but also, probably in a nationwide environment. So thank you for that. I just wanted to ask a clarifying question from Mr. Martinez. You said that people could set up a form so that to provide custody. I just wanted to, and then you clarified and said it would be so that they could take him home. But it's not a permanent custody of the child. It's really just kind of a caretaker custody. Is that correct?
That's correct. It's our affidavit. So it has no legal binding outside of the school, but it is an affidavit for our school sites to release the student should the family be affected adversely. And that, again, it supersedes just ICE. But, we have families that experience certain situations, and so they can fill out that affidavit to provide access to someone in their family to be able to pick up their child and then support their child during their school days while they are not available.
And then Monica online says, how do you ensure that these protocols are being followed? And what are the checks and balances and the messages are the same across the board? Or is the message the same for all schools?
Yes. So the message is the same across the board. So in operations, which is called what I'm going to call the district operations, they develop these protocols. We developed an IOC, which is an inter-office correspondence that guides our principals. And then that comes out to the region offices with the PowerPoints and the slide decks. And then we have trainings for our principals around this information. And then it's disseminated to the principals, and the principals disseminate to their staff. That's the protocols that we follow across the board. So we want to make sure that we're ensuring that all the principals are using the approved PowerPoint and that they're informed. We also provide them with guidance and all of that. As far as checks and balances are concerned, I don't know if I don't know what that's referencing. However, I will say that we do have established protocols if ICE or any law enforcement entity enters our school, and how we can provide support for the school sites to be able to manage that.
And also from the chat, the concern is that ICE has been, doing a type of strategy this summer that is certainly not following the law.
Yeah.
So, there's definite concern around that.
Right. And so one of the incidences that we did have during the summer, right, again, LAUSD does shrink during the summer because we offer our summer school programs, not at all schools. But one of the incidences that did happen is MacArthur Park, right? We all saw that in the news. We saw the MacArthur Park incident. We do have 2 schools that are adjacent to MacArthur Park. And then we reached out to the school sites to see what effect it was. We deployed staff. We provided messages for our families. Again, we went through the entire protocol process that we follow as a district to ensure that our families are informed and ensure that our students are safe.
Hi, I have 2 questions in the audience.
For Mr. Martinez, my name is Julie Rivera-Coo, and I'm an attorney. I just wanted to clarify, does LA Unified have their own caregivers affidavit, and are you asking parents to pre-submit those and have them with the kid's school file, or you're just saying they can use that in case they're detained?
So 2 things.
Because the caregiver affidavit is a state form, right? And so I'm trying to figure out if LA Unified has their own form.
Yeah, I can drop in after I'm done presenting. I'll drop in the chat this caregiver affidavit. And so once again, legal services go through legal. Thank you, Julie, for bringing that to our attention. Secondly, there's two documents that we have that are important, right? One is your emergency card, and that emergency card establishes individuals that we can contact if we can't get a hold of the parents to come and pick up the children if there is an emergency. 2, if parents are adversely affected for whatever reason, not necessarily ICE, but whatever reason, then there is a care affidavit that we have as a district that allows for parents to fill out. And we're not asking them to pre-fill it, right? But families can decide what's in their best interest. So some families have pre-filled it, some families are waiting. I mean, it's a case-by-case basis, but we do make that resource available.
And one more question.
Sí, buenos días. Mi nombre es María Ponce de León. Y soy
Morning.
promotora
My name is Maria Ponce de Leon. I am a healthy promoter in the area of Lincoln High. We've had discussions with different people, not only Latin people. We know that many Asian people with different languages, for example, Cantonese, Vietnamese, and their immigrant communities. Is there any information for these families as well?
So can I answer in English or should I answer in Spanish?
Yes, basically what she says that she's a medical provider. She's a promoter for medical, and she works in the Lincoln Heights. And her concern is that there's a lot of Asian community. They speak the Mandarin, Chinese, Cantonese. And my question to you is, if you guys provide that type of information in their own language?
So the beauty of LAUSD is we have many languages. And so all of our documents are provided in those specific languages. So in reference to Region East, we have Arabic, we have Farsi, we have Cantonese, we have Spanish, we have Mandarin. And so we make sure that all of our information, specifically around the We Are One information, is in multiple languages and available to our families. So yes.
Okay, one last question.
Good morning. Good morning. Diego Rodriguez from Alma Family Services. And I just want to also acknowledge the incredible work being done by LAUSD and the incredible partners on the call, including Ana Marie Gauto, who has been a long-standing champion in support of students in this area and beyond. Just a quick feedback on the We Are One resource guide. That resource guide is very popular. I think it's very well done. That said, there is a digital divide, right? And many parents, grandparents, caregivers, they might not have access to this resource digitally. So just encouraging the district to expand the printing and distribution of the resource guide, either directly or through your network of service providers. As Alma, for example, is in dozens of schools, and we stand ready to support this effort and use community health workers, right, to take the resource guides into the community to parents that might not be already connected to the school. So once again, thank you for the work being done, and we really reassured that LAUSD will continue to work to support our students and families.
Thank you. And one of the things that we do is we do share out this information to our school sites. Any document that we have is printable at our school sites, so a parent can just request it, and we can definitely print it. One of the other things that we've done is, if you notice, that we put QR codes, so we know that most everyone has access to a cell phone that can scan a QR code, so they can access it through that. And so we want to make sure that everyone has access and everyone has this information. We passed out the red cards, right? I don't know if you all are familiar with the red cards that provide guidance, if you would, around questioning of ICE. And so I know that we've done we're continuing to do a robust messaging to our community so that everyone is informed. And I wanted to say thank you to everybody. Anne-Marie Gauto is super popular amongst you all, and Anne-Marie is just an amazing asset, and I have a pleasure of working with Anne-Marie on a regular basis. And Alma Family Services, I know that they were on my campus when I was a principal, and I know that we have excellent partnerships with many mental health agencies. And so we want to make sure that we share this and it doesn't function in a vacuum or a silo.
Thank you so much. And we do have a comment from Jasmine from Supervisor Solis's office. Are there surveys sent to students' families to identify additional needs such as access to food, rental assistance, etc.? Is there data on whether resources such as mental health are being utilized or a potential need to increase it is needed at schools? One counselor per school does seem too scarce.
So a couple of things. So one, if families are experiencing need, we have a SHQ, which is a student homeless questionnaire.
Questionnaire.
I'm sorry, Henry?
Student housing questionnaire.
Student housing questionnaire, sorry. Student housing questionnaire. And that asks several questions. And once we have that form filled out, then we could provide multiple resources for families. For example, food, rental assistance, clothing. We actually have two boutiques in our region that provide clothing for our families. So yes, definitely. So they can definitely connect with their school site if they're facing any financial hardships, specifically around need for students. Secondly, I want to correct the misnomer, I guess, that's out there. We don't only have one counselor per school. There are several schools that have one PSW. However, there are several counselors available at each school site on any given day. For example, we have the school psychologist, we have the pupil services and attendance counselor, we have the special student support programs counselors, we have high school academic counselors. And so there are multiple counselors available on a regular basis at our school sites. But if there is a crisis, the school does have a crisis team, and we as a region have a crisis team to respond and provide extra support for major crises.
Well, thank you again, LAUSD, for your leadership and for being a part of this important continued dialogue. We did take more time than we should have, but it's such an important topic. We appreciate the time that we're taking here. I am going to rejigger the agenda just ever slightly because I have Claudia Cardenas from Primestor and Centennial Partners that's here to invite us to a community meeting that's upcoming. And then right after her, we're going to have the LA Conservancy also invite us to an exciting tour of our general hospital that's coming up in about a week.
Thank you so much, Rosa. Good morning, everyone. My name is Claudia Cardenas. I'm with the Primestor and Centennial Partners team. And as Rosa mentioned, we are here to invite you to join us to an upcoming community meeting scheduled for September 27th. We have our flyers here and on the presentation for you to get all the details and register to participate. As many of you are aware, there was a motion that was recently passed by the County Board of Supervisors with support from many of you here in the room. So we are able to now move on to the next phase of design and planning. So we're very excited to be entering into this phase, and we invite you to come along and be a part of it.
Thank you so much. And now we're going to have, where are you? Alex from the LA Conservancy is going to join us to share a wonderful invitation for our community. Alex, are you there?
I am here, yeah. Thank you very much. And I'm happy to be here. I won't take up people's too much of your time. My name is Alex. I work at the Los Angeles Conservancy. We are a historic preservation nonprofit that advocates for the preservation of historic sites and cultural sites all over LA County. And we have been working very closely with the county, with Centennial Partners, with the Wellness Center to be able to do tours of the historic LA General Hospital. And we have been working very hard to be able to get into this building since the public has not had access to it for about 20 years or so. And we have finally been able to secure access. And so we're very excited to invite everyone here on this call. And Rosa is going to be sending out an email to more community partners as well to be able to come and see this. But I will be posting in the chat some links that are free tours from at 11 o'clock, 1 o'clock, and I believe 4 o'clock on Saturday. And then I think we're also going to be doing some free tours as well on Sunday, I think at 11. We're working on that, scheduling for that right now. But if you're interested at all about learning more about the history of the building that was built in 1933 and learning a little bit more about what sort of the future holds for that project, which is in the process of being reused as housing and mixed use restaurants and that sort of thing. We'd love to have you out and to talk a little bit more about that. We'll also be having a panel discussion on site on Saturday from noon to 1:30. And so if you're interested again in learning more about everything that's going to be going on there at the historic hospital, we would love to have you. I will post that all in the chat for you all there. Thank you very much. I appreciate your time.
Thank you so much, Alex, and to the LA Conservancy and Supervisor Solis's office for making this wonderful opportunity possible. So if you're interested, there are community slots that you can sign up for, and they're going to drop the link in the chat. If you're in the room and you're interested, go ahead and approach Elijah or Christina in the back, and we'll be able to help you register for one of the tours. All right. And the times are coming up on the chat as well for those online. All right, we're getting to the end of our presentations, and we have wonderful partners from Neighborhood Legal Services that are here, Neighborhood Legal Services of Los Angeles that are here. A wonderful and dear friend, Julie Rivera-Coo, is here with Michelle Lilienfeld, who will talk to us about family safety plans and a medical debt relief program. So if you want to join us up here, we'd love to have you. And while they're making their way up here, just remember to drop in any questions in the chat as the meeting is coming through. If we don't get to all the questions, we can definitely respond via email.
Michelle, can I go first? Because hers is nice and quick.
Oh, okay. Does she have a presentation?
Hi, good morning. Buenos dias. My name is Michelle Lilienfeld, and I'm an attorney at Neighborhood Legal Services of Los Angeles County. And I'm here to share with you some information about a new project at our organization regarding medical debt relief. So medical debt is a critical issue. A recent report, oops, I'm touching the power. There's no power, sorry. A recent report showed that 1 in 9 adults in Los Angeles County are impacted by medical debt. This is an issue that continues to disproportionately impact low-income communities and communities of color, and it affects both insured and uninsured individuals. So Neighborhood Legal Services received a grant from Supervisor Hilda Solis to help eligible consumers with medical debt. So this is for eligible residents of Los Angeles County Supervisorial District 1. And through this project, we will help eligible consumers pay their medical bills. Payments will be made directly to the providers, and both medical and dental bills will be considered. So who's eligible for this project? To be eligible, applicants have to live in Supervisorial District 1. And if you all were wondering where that might be, we are in Supervisorial District 1 right now. It includes Boyle Heights, East LA, downtown Los Angeles, the San Gabriel Valley, and cities like Alhambra, El Monte, West Covina, Pomona, and many more cities and communities. The other eligibility criteria is that the bills must be at least $500, and we all know that a medical or dental bill can easily be over $500, but if a person has multiple bills, they just have to at least total $500, and the dates of service have to be within the last 2 years. There are also additional eligibility and selection criteria, which I will not go into right now. But what I do want to point out is how a person can apply. So there's a special hotline number for this project. And Adam Escalante from our office is here as well. He's a paralegal on this project, and he's brought flyers for you all. And we will include them with the materials that are sent after the today's meeting. There's a special 800 number that's listed here. That phone number will lead a person to a hotline, a special hotline. The messages are available in English, press 1 for English, press 2 for Spanish, 3 for Mandarin, 4 for Cantonese. We also have these flyers in multiple languages: English, Spanish, Mandarin, and Vietnamese. It's not a live hotline, so a person needs to leave a message and we will return the calls within 5 business days. The flyers also include a QR code. If a person wants to apply online, it'll lead them to Neighborhood Legal Services online portal. They can do an online application there and they'll be referred over to the medical debt relief team. So we wanted to let you know about this amazing opportunity. Please, let us know if there are any questions. We're happy to answer them. And we have the flyers here to share. And thank you so much for the opportunity to share about this opportunity. Any questions? Okay, thank you.
So can I control the slides from this computer? Thank you. My name is Julie Rivera-Coo. I'm an immigration attorney in Neighborhood Legal Services. I work out of the El Monte office, but we have several offices throughout the Los Angeles area. So I'm here to talk about family preparedness planning, and this is for immigrants. And I want people to know your rights. We're going to talk about planning for yourself. And so I usually do this for immigrants who are concerned about these issues. I know not all of you are immigrants, but that's why I'm presenting it as if you were. And also planning for your children. So we know about the red cards, and there's red cards here. I saw them, but every person has rights in the U.S. You can assert your rights under the 4th and 5th Amendment. So 4th Amendment protects against unreasonable search and search and seizure, sorry. What I want you to know is under this, you don't have to give permission just for someone to enter your home. If ICE is at your door, if they're not telling you who they are, but they're pounding on your door, you do not have to open that door unless they have a search warrant. And the search warrant has to be signed by a judge. Many times they will show you a form. The form is signed by the ICE officer themselves in their office. And so you please make sure that it's signed by either a state judge or a federal judge. You also don't have to allow them to look through your backpack, your purse. Sometimes they just grab it. And you can say, I do not give you permission to look through my bag. I do not give you permission to look through my backpack. It's important that you say it. They may be looking through it at the time, but you may be able to assert your rights later on down the road, especially if you verbally told them, I do not agree to this. Your fifth, the 5th protects your rights against self-incrimination. You have a right to remain silent. You guys have heard that, right? And you have due process rights. We are now telling people, because we used to tell people, remain silent, don't say anything. And with the changes in policy and with things changing rapidly, what we are telling people now is, am I being detained? Right? I'm not telling them my name. I'm not telling them I'm from Guatemala and I have TPS. Like, you're not telling them. You're saying, am I being detained? If they say no, then may I leave? And you can walk away if they say yes. It's finished, right? If they say, well, I just want to ask you some questions and just answer these and then we'll let you go, that's when you remain silent. Okay? So by offering information, like, I'm from Mexico and I filed for asylum and my case is pending and I have a work permit. I've just given them everything they need to detain me. Right? And people think like, well, let me pull out my, my receipt notice. That's not going to protect you necessarily because you've told them you're not from this country. You've given them probable cause. You have something pending, but no decision. So they might be able to detain you, right? So that's why you remain quiet. And there's a saying in Spanish, calladita más bonita. Uh, uh, and so if you kind of, nice and quiet, you're not going to have any problems. Basically, that's what it means. So it's something, I know it's hard. I know that when I've done, we do mock interviews, like ICE interactions. I get nervous. I'm scared. And I'm a lawyer and I know my rights. But if somebody's constantly asking, like, well, just tell me this, and I'll let you go, and they'll trick you. The last thing I want to say is, please don't sign anything until you speak to an attorney. They're going to scare you, especially when you're detained. You're going to be, this is what they're telling people. Just sign here. You'll be able to fix your papers, once you get home, and don't worry, it's not a problem. There was an LA Times article about this man from Mexico who signed. He had rights. He would have been able to stay here, but now he's got like 2 or 3 kids. And the wife is going to stay here because she has some status. The kids are going to stay here, and he has to stay in Mexico. And his kids miss him. He misses them. And if he had just not signed, they wouldn't have returned him to Mexico, and he could have gone in front of the immigration court, and he had a strong case, right? But now he has to wait 10 years because of bars that he has because he left the country and he was deported. So please talk to an attorney. And it's so one of the handouts that I have a removal defense attorney list, and there are nonprofits and private attorneys. Please know, nonprofits are overwhelmed. Private attorneys are overwhelmed with cases. So you really have to call around and find somebody. And we are telling people, if you think that you're at risk of being picked up, you really should hire an attorney before you're picked up. And you pay a deposit with them. They have your information. They have your signed documents. So if you were ever picked up, they can quickly move on your case. I know that's not always financially possible for everyone, but if you're really concerned that you're going to be picked up, it's really important that you do this. Okay. Why should we prepare to reduce stress and anxiety for your family? If there's a plan in place, everyone knows what to do, and it reduces the potential chaos. By planning ahead, you can see where there are challenges and make sure resources are put in place to make the plan successful. So what does a plan include? So LA Unified already talked about, like, hey, there's plans, there's forms you can use, and they happen to use a form by ILRC, which is a very good, respected nonprofit agency. They're based out of Northern California, but nationally they're respected. So I also brought plans from Neighborhood Legal Services. I like the ILRC plan. It's just very long, and it asks for information that I think it's a little overwhelming to fill out because it's so long and so many pages. I tried to distill just the most important information. So Neighborhood Legal Services has their own plan. So we're going to talk about Family Preparedness Guide. So it's information about your attorneys that you have, emergency contact lists, list of documents and locations of the documents, information about the persons that could help post bond for you, your employment information, and your financial documents. So ILRC combines these two. I made 2 different ones because not everyone has kids or they have adult children that you don't need the child information form. So for every child information form, for every child, you should be filling out a child information form. So this is regardless of whether you think, well, I'm never going to get picked up. I'm a legal permanent resident. People are being picked up and don't even know. I think that if you're a legal permanent resident, if you're anything but a U.S. citizen, you should be preparing, and you should have your information, and you should be organized. Are we? So here's a QR code, and that's our website. Okay, and that contains the forms that a lot of the forms that I'm going to be talking about. Not all of them. I'm about to update this, and so if you give me 2 weeks, everything will be up there. But I brought a copy of everything here. You got it? What am I doing? Oh, okay. This is what the family preparedness guide is. This is for the immigrant, the person who's filling it out. So let's say the mom. You've got to find somebody that you trust, right? That you know that you can say, hey, these are my documents and this is where I left them. This is my car pink slip. This is my lease for my house. This is all the important things that you need to have. Memorize those phone numbers because you're not going to have access to your phone if you're detained. They take your cell phone, right? So nobody memorizes phone numbers anymore. My mom's new home number, I don't know it. It's only on my cell phone. We have to know those numbers. Determine if you're in a category of people who might be deported very quickly and consult with an attorney. I just talked about that. So that where the arrow is, that's where you would put the information about who your trusted person is, right? It's going to have other information. Oh, I'm so sorry. Thank you. I will. Do I need to? Maybe I'll do it. And just tell me again. Okay. So below that is if you have any other attorneys. So I tend to help. I'm an expert in U and VAWA, T cases, that kind of thing. And so you have other attorneys. I'm not a removal defense attorney, but that's where my information would go. And you want all your attorneys to know who's helping you. That's why you list everything. You're going to include your A number, your emergency contacts, and your deportation defense attorney if you have one. Sorry. So gather the important documents that you may need. Here's a list of some of those important documents. There's others, but you want your birth certificates. You want your passport. You want your marriage certificate, your social security cards, your medical records, your vaccination records. There are all of those records. Oh, is it? I'm not speaking directly. Oh, okay. So, I know, like I always use my mom as an example, and Rosa knows my mom. So she has papers everywhere, right? So if something, God forbid, happens to my mom, I wouldn't know where to find everything. Some are in the file, some are in the closet, some are in a shoebox, under the bed. We need to organize those documents. We need to have them in one place so that your trusted person can find them. Because if you're detained, removed, you're going to need those documents. And if people can't find them, it doesn't help. This is my mom. It's in the bottom of the drawer. No, Mom, it's not there. Maybe it's here. All of those things need to be in a place where everyone can find them. So you're going to leave the phone numbers of your family and friends here. And you want to consider whether you want to notify your employer, right? Maybe it's your last check. Maybe that trusted person is going to pick up that last check, or maybe that trusted person is just going to call and say, they're not going to be able to show up for a while. I don't know when they're getting out. So other things to think about: rent, mortgage, bank accounts, cars, property, taxes, return to you, like taxes. So I have money coming to me, right? You want to know, make sure that it's getting into the right accounts. Your debts, your credit cards, your cell phone, your businesses. You might need to stop some of those accounts. And so you need to know your PINs, you need to know your passwords, you need to be organized about what you have. And this is where you're going to put that list together. So some people own homes, some people have cars. What's going to happen you know, if the pink slip isn't in a place that the people can find, it's going to be hard to sell it or to send it to you or to figure out what the steps are. So there's a short-term plan. Who will take care of your children? This is where you would do it. And then you can, down below, you can talk about your long-term plan because it might be different. And you need to start thinking about, if something happens to me, do I want my children to go back to my home country? Do I want them to stay here? If they're going to stay here, who are they going to stay with? And who's going to be responsible for them? Are they old enough to be, are they 18 and they can stay without a problem? But maybe they're still in high school, and what are those steps that you need to take? And so when I tell you, please be aware of California custody laws, there are, you need to know, what orders do I have in place? Did I get divorced and now there's orders, or there's a paternity case, or there's a child support case? There might be, or a restraining order case. All of those orders are really important, that number one, you have them for your trusted person saved in a place, but that they're aware of it, and this may impact where your kids go. So the child information form, one is filled out for each child. These are the forms that you should have for each child: birth certificates, passports, their vaccine records, their medical records, their full name, the school name, teacher's name and room number, aftercare program, other caregiver, contact person, your child's allergies, their medication that they're taking, a copy of the IEP if they have one, a copy of, you know, any medication or any special instructions for your child, health insurance information. And all those things are kind of listed there because the trusted person is going to have that information so that they can follow through on your request and take care of your children. So if they don't know your child's allergic to amoxicillin, and they have to take them to the emergency room, what happens, right? So you want to make sure you have that information. And so there's insurance, special needs, and I'm running out of time, so I want to make sure I rush through this as quickly as possible. This is what I kind of do want to talk about. Okay, there are different options, and I'm going to call it a range. A range from, I'm not going to do anything and I'm not going to think about it, or next step, I'm going to informally talk to my cuñada and I'm going to ask her if she will care for my children if something happens for me, right? And then that's a verbal agreement. So the caregiver's authorization affidavit is a state form. It is law under the family code section. And LA Unified and mine are exactly the same, except mine doesn't say LA Unified on the top. I have it in English and Spanish with me. And there's also an authorization for care provider to consent to medical and dental treatment of minors. And on top of that, there's a minor power of attorney. And the other option is a legal guardianship and a possible nomination of a guardian. So if you're at high risk of being detained and removed from this country, then maybe you want to think about and you want your children to stay here, legal guardianship might be the best route. The only thing is that as a parent, I don't like to advocate for legal guardianships because I am giving my right up as a parent, and a judge is going to decide if I get my child back. So if I'm gone 3 years and then I come back and I'm able to fix my papers and everything's good now, and I come to pick up my kid, I can't just pick up my kid. I don't have a right to. I have to go to court, and the judge has to decide that it's in my child's best interest to come back to me. Now, if my child is now thriving in the high school that they're at, doing well, and, you know, has his friends and doesn't want to change high schools back to, you know, where I'm living now, the judge may not decide that it's in the best interest of the child because they don't really care about my feelings. They only care about what's the best interest of the child. So with that caveat, I talk about legal guardianship because I want people to understand that. It could even be your sister, and you're just like, I don't think you should have your kid back, and I really love your child, and they're going to stay with me. Or they might be, oh, you're back, good, here you go, right? Like, you never know how that person's going to react, but I want people to know that. The other thing I want people to know is, especially in the immigrant community, Latinos in particular, they love notarios. A notarized letter is not recognized in California as a way to give custody to someone. So you can't do a notarized letter. Oh, el notario me lo firmó. Like, I got it signed by the notary. It's all done. It's all good. That is not going to give legal custody to anybody, right? And so that is not a good option for anybody. So the caregiver's authorization was, which we're going to talk about real quick. I only have like 3 minutes, right? So just to clarify, the caregivers, this is the caregiver's affidavit form. This is what LA Unified has. We have this on our website. It is the parent does not sign this. The caregiver signs it. The caregiver with this can enroll them in school and take them to the doctor. You won't have any issues if your caregiver is a relative, related. But if they're a best friend, if they're a neighbor that you trust, this becomes problematic because it limits what they can do. So there are instructions on the other pages. So this form should be saved with your safe documents. You can have it, one for each child, right? And so you can even fill out the top part, the name of the minor, but it'll be signed when they need to take over, right? And so you don't need to sign this. It would just be with your safe documents. This tells you how to fill it out. So the power of attorney is a little bit more than the caregiver's affidavit. And we're at a hospital right now, so I'm just being honest. Doctors, hospitals, schools, they like these power of attorneys. There's state law behind them. They're not perfect either, but this is notarized, right? And so again, the hospital sees the notarized stamp, right? And they see that. So it looks more official than the caregiver's affidavit. And it allows you to either notarize or have two witnesses. I would urge you to notarize it because it's more official when it's notarized. Like I said, the people who like it because it's got this little notary stamp on it, and it looks official because it looks like a legal form. The caregiver's affidavit is a very simple form. It's one page. It's signed by the caregiver. So it doesn't allow them to do everything. Like, they're not able to consent for a child to go on a field trip, right? Weird things like that. They're changing the law. It hasn't changed yet, hopefully soon. So this is where the notary signs. And there's another form that's a little shorter, that's authorization to consent to medical dental care of minor. I have it in English and Spanish. I have it with me, so if anybody wants it, I'm happy to provide it. That's the ICE locator. So if you're looking for your family, it takes at least 24 hours for them to show up. You need their A number, their legal name, where the country that they're from, and their date of birth. You can also call Immigrant Defenders Rapid Response Hotline. They can help you find your loved ones. And here's another link to our information. So anybody have any questions? I know that I rushed through that, but.
Buenos días, tengo una pregunta.
My question is, good morning.
La pregunta es para más que todo para una persona que es residente.
This
o
is for
ciudadano que es
a
arrestada
citizen
por ICE, porque
and
ellos lo
resident who
arrestan,
was arrested
te
by
llevan y
ICE.
después te
They
preguntan,
take you and then afterwards they ask you questions.
¿qué ley le protege?
What
Porque
law
para
protects
salir le
these
piden una
citizens?
fianza
Because
y
if
son
you're
diferentes cuotas.
bailed and you have
¿Qué,
to
a
pay
quién
for
también
different
podemos
penalties,
acudir si también
who we
un
can resort
ciudadano,
to
un
if a
residente es
resident
arrestado
or
por ICE?
citizen is arrested by ICE?
So, good morning. I have a question. This is for somebody that I know, but what if a person is arrested and is a resident or citizen, and they're arrested by ICE and they're taken to court? I know that, is there any law that can protect them? Because I know for them to get out, there's a bail, and the bail can be different costs. So I just wanted to know what can happen if a citizen or a resident is arrested by ICE.
It's a really good question. And that's more for a civil attorney because I think it may be a violation of your civil rights if you're detained, especially as a U.S. citizen. And it is, right now, it's up in the air about how long are you going to be detained for? Because what they're doing is they're releasing those people, but then they're charging them criminally for getting in the way of the ICE, and so then they're putting criminal charges on them. And so that's a separate, they've got to fight that in criminal court. Sometimes we're seeing that they're dropping those cases because there's that's what the LA Times said, that a lot of those cases were being dropped because there wasn't sufficient evidence. But, you're still going to have that arrest on your record for life, right? It's problematic. But so I'm not the right person to answer that. I think it would be more of a civil attorney or a criminal attorney. Okay, no other questions?
Hola, buenos días. Mi nombre es Alejandro Castro y hago alcance
Good
comunitario.
morning. My name is Alejandro Castro, and I work with the community services with another group. I want to congratulate this organization for these resources, and we have this response from for the community. Thank you so much, and congratulations for this great work you do. Thank you so much.
I have the documents packets up here. Oh, there's one more question. No more questions? Okay. Yeah.
He said, good morning, my name is Alejandro Castro. I'm part of a significant community group. I just want to congratulate this organization. The resources that you are giving us is very important, and it's a very valuable response that we can give to the community. So thank you, and we appreciate everything you do.
So I'm gonna put some packets up here. You're gonna notice that they're gonna be in English and Spanish. Feel free to take the ones that you need and know that you'll be able to get the majority of those documents at that QR code right there. I'm gonna have this. I'm gonna do a videotape class that'll also be that just on these issues specifically that you can access from this link as well, this QR code. That'll be up in about 2 weeks, okay?
Thank you so much, Julie. And Neighborhood Legal Services of Los Angeles and her colleague, Michelle Lilienfeld. We want to thank you guys for being here. We are at the end of our presentations. We just did the partner announcements. I did see on the chat that the links were placed for the Conservancy visit on the 13th and 14th. So if you'd like to join us and you're in this room, let us know so we can get that link to you and get you registered. If you register through the community link, you don't have to pay. And that's really important because there is a fee for those that that can pay because it helps the Conservancy do their work and then make a donation to the work that we're doing at LA General, at the General Hospital building. Okay, with that, a reminder that the community meeting for Centennial Partners and the reuse of General Hospital is coming up There is a flyer that was dropped in the chat. There's a flyer in the room. So please register for that. It is Saturday, September 27th at 11 a.m. and it is virtual. But if you have trouble getting on our meetings, virtually, we're probably going to have a location at the Wellness Center. Inner City Struggle has said yes. There's a couple of other organizations that are going to have their doors open to make sure that we have an in-person opportunity for those that want to join us for these discussions. And invite your friends. Invite your friends to tell us what they would like to see in the Historic General Hospital. Save the date. There is a groundbreaking for the Restorative Care Village and First Century Housing, which is the 300 units of housing at the corner of Mission and Zonal. So we're going to do a groundbreaking for that. So October the 8th is potentially the date. Please save that date to join us. And our next Health Innovation Community Partnership meeting is Friday, October the 3rd in either this room or the room next door. Please join us at 8:45 in the morning. And there's also going to be the hybrid option. And I think that is the end of our presentation. So thank you, everyone, for being a part of this wonderful conversation. Thank you to all of the leaders that are looking very diligently at our budget, at the challenges that we're facing in our community related to immigration. And please, if there's a topic that you want us to include, let us know so that we can start working with them. The week after these meetings, we have a group called Co-Design that is a group of our leaders here that comes together to make sure that we put together a strong agenda for our community every month. So please let us know that you want to be included, and we're happy to include you in our future meetings. So with that, thank you everyone so much, and have a lovely drive home if you're here, or walk home if you're here with us. And for those of you online, have a wonderful weekend and rest of your month. Thank you so much, everyone.